Hi, Leanne. I can't hear you.
Sorry, I didn't have the link.
Oh, sorry. I thought we'd done it, but you've got there anyway. That's the main thing.
Yes, yeah. Good.
Right. So hi everybody who's on here. Craig is going to record transcribe the meeting if that's okay, just so that we can
I'm going to post it on YouTube afterwards.
Okay. It's just that we would need to obviously keep all your contact details so that we can follow anything up. So today's session is obviously with Leanne Holman, who's just here, and she's going to basically give you an overview of what the Open University offers: foundation degree, nurse and associate apprenticeship, and also we're going to take any questions that you might have as well. Is that okay with everyone? Can everyone put their cameras on, do you think? Would that be okay so we can see you all? I'm happy to put mine on, but I'm outside. That's lovely.
Hi, everybody. I'm just uploading the presentation. Don't worry if you've not got a camera. So just give me a moment. It's just uploading the PowerPoint slides. So just to say hello, I'm Leanne Holman. I'm one of the staff tutors with the Open University. I look after all the nursing associate students within the East Midlands region. So I'm responsible for recruiting and selection onto the programme, and then also sort of looking after the students once on the programme, and also liaising with the employer. So that'll be with the training hub and Sarah once students are on the programme to give them support. Okay. So good to see so many people here today, and I'm just going to give you a bit of an overview. I don't know whether anybody knows much about the nursing associate programme at all, or have had a look into it and what it comprises. And I can see we've probably got a mixture of potential applicants and managers as well. Is that right? Yeah. Okay. So I'm just going to give a very brief overview of what the programme's all about, just to give you some ideas. And so first of all, what an associate does. So it's slightly different. It's quite a new concept into the workforce. So it's a new member of the nursing team, just in England only. And this role is designed to help bridge the gap between health and care assistants and also registered nurses. So it's that next level up from a healthcare assistant, working alongside registered nurses. So it's a standalone role, but it also provides a progression route into graduate level nursing. So that means that there is a top-up programme for students who have already completed the nursing associate programme to then go on and do complete the training to become registered nurses. And that programme, that top-up programme, is going to be a 20-month programme. But the Nursing Associate programme is a programme that runs for 2 years. So nursing associates work with people of all ages, and the main thing about the nursing associate programme and how it differs to the nursing programme is that it's not field specific. So nursing associates need to get experience of all fields of practice, and also experience of working and caring for people across the lifespan. And so they have placements and external placements in order to achieve those requirements of working across all fields of practice and with all people across the lifespan. So one of the main differences to contribute to the core work of nursing, and then this is freeing up registered nurses to focus more on the complex clinical care. If you have any questions as we go along, just let me know. I'm not sure if I can see everybody, but either just pop your hand up or just stop me as we go along. So as we said, they're trained to work across people of all ages and across a range of settings. And there's a special standards of proficiency for nursing associates. So what you do when training to become a nursing associate trains you to meet these standards of proficiency and be proficient as a nursing associate within practice. Nursing associates are accountable for their practice, and since February 2019 have separate registration with the NMC, and so on completion of the nursing associate programme become eligible for registration as a nursing associate. So everything you do while studying to become a nursing associate is aiming to achieve the standards of proficiency which is set out by the NMC and enables you to become eligible for registration on completion of all the standards of proficiency. So just a few sort of differences there about how a nursing associate is different to a registered nurse. And you can see that there's 6 platforms rather than 7 platforms of proficiency. And with registered nurses, there is the assessing needs and planning care. Whereas with nursing associates, this is more to aligned to contributing to integrated care rather than the coordinating care, and also monitoring care rather than evaluating care. So it's just that slight step down from being a registered nurse, but still monitoring care and contributing to integrated care. So with the nursing associate programme, we need to first look at entry requirements. So the Open University has an inclusive approach, however, to entry to degree programmes. However, because this is an NMC regulated programme, there has to be some minimum standards in order to meet in order to come onto the programme. And this is set out by the NMC, the employer, and also apprenticeship standards too. So I don't know whether if Sarah's there, do you have any specific employer specifications that you have? Some other employers like to have like an MVQ or certain.
No, it's standard, Leanne, with
it's a standard
in line
ones.
with the NMC, yeah.
Okay, so there's no employer specifications. However, the programme entry requirements, this is because of the NMC, needs to show on application, on the point of application, that this has been achieved and have certificates to show that. So it needs to show that there is literacy or numeracy skills, and this needs to be functional skills level 2 or equivalent for both, or GCSE grade C or above. And this needs, you need to have this at the point of application. If you don't have these at the point of application, unfortunately, the application would not go any further. So if you have any anything other than functional skills level 2 or GCSE grade C or above, and you're unsure if that is equivalent, then obviously just sort of speak to Sarah or to the training hub, and they can run it past us so we can let you know whether that is sufficient. You also need to have evidence of good character, and this is evidence through self-declaration, and also references from your current employer, and also evidence and declaration of good health. And this is evidence through self-declaration and also from your references from your employer too. Now, we often get asked if anybody has any convictions, does that stop them from applying for the programme? And the answer is no. However, we need to do an applicant suitability checklist as part of the process of accepting people onto the programme. A DBS check is done. So if there are any convictions, then please do disclose or say in your application that there are convictions, but we just need to go through a risk assessment process in order to determine the suitability for the programme. And also make sure that it would be you'd be suitable for registration with the NMC. Any questions at all so far? Okay, with the standard, so it's just literacy and numeracy are the only requirements for entry. Now, there is a selection process. So this comprises filling in an application form. So if I'll go back a step, after today, if you're interested in applying for the programme, you would contact, I think it'd be Sarah, and give your details that you are expressing an interest. Sarah would then collate that information, what we called an applicant detail form, and then that would be sent to myself, and the any potential applicants would then be sent an application form. So a link to complete application is sent to all potential applicants, and there is some dates which we've only just got through, which I will talk to you about in just a moment, about what the deadlines are. So at the moment we're talking about recruitment for the October 2022 intake. However, we usually have 2 intakes a year. So if it's something that you're not sure about doing for this time, then we could possibly be looking at applying for the February 2023 intake, which I'm sure we'll be carrying on doing. So that's the 2 intakes per year. So it involves completing the application form, and within that you'll be asked to write a personal statement. There's a few bits and pieces which you'll need to gather evidence of, and that would be having your certificates, so of English and maths, or your literacy and numeracy skills. So if it's something you're thinking about applying for, it'd be good to try and find evidence of those certificates from now onwards, because often students can have difficulty, particularly if it was a long time ago, in achieving those results. So you do need to have that. You need to have references from your employer as well, and also complete the application form in full. Now, after all the applications have been submitted, myself and a representative from the training hub will sit through, and go through all the applications, and they are scored on the personal statement. So it's really important to think about what you write within this personal statement. There's a minimum score which needs to be achieved in order to go through to the interview process. I'll go through to the next stage to be interviewed. So again, all successful candidates who have achieved the minimum requirements in shortlisting are invited to an interview, and this is where we have an assessment of your personal values, and also your your suitability for the programme, and your suitability for distance learning, and why you want to do the nursing associate programme. Now, this isn't a hugely extensive interview. It's quite short, with just a few questions that usually lasts around 45 minutes. And again, this is done on a scoring system, and applicants would need to achieve a minimum score in order to be offered a conditional place on the programme. So for any of you who do get the application form, just a reminder to complete the application in full. If any elements are missing, you will be rejected at shortlisting. So it's really important to try and have the time and get anything ready beforehand, and make sure everything's ready before you submit your completed application. Because once you get rejected, it's very hard to try and get back into the shortlisting process. Now, I'm just going to talk to you about some of the dates whilst we're here. And I can tell you that the dates have just come through. Have you seen sight of those yet, Sarah?
Yes, I have. Yes.
You have, yep. So for the October 2022, the applicant details forms need to be submitted by the 3rd of June. The application deadline is the 17th of June, so that is when all applications for the programme need to be submitted by. However, we might have some local deadlines for this. The very final shortlisting would need to be done by the 6th of July, and all the interviews, final interviews, need to be completed by the 27th of July. So, however, we've not arranged dates, specific dates with the training hub yet for those interviews and those shortlisting dates. So that just gives you an idea of the timeframes rather than the actual deadlines for the training hub and for this programme. I can see someone's got the hand up there. Is it Chloe?
Yes, it's me.
Hello.
Hello, I've just got a question.
Uh-huh.
So obviously regarding the skills that you need to get into the course, my question is really, if you didn't have one of them but you're willing to go onto a course to complete that, would that still be accepted, or?
No, you have to have both at the point of application.
Okay, no, that's fine.
Yeah, unfortunately.
Okay, thank you.
Okay.
Chloe, the training hub, Chloe, are looking into recommending a functional skills course, an e-learning course. So we are looking into that at the moment because lots of people have asked us about it, but there are lots of different courses available that offer maths and English functional skills levels. But we think it's really important that actually you have some face-to-face time built within that with a tutor. So we're just looking at sourcing one of those. So that will be coming, but obviously it's not going to be immediate. But obviously you can go online and you can look at joining any of the e-learning skills for health or the functional skills assessments, and you'll be able to work your way through their programme and get a certificate at the end of it. Is that okay?
Yeah, that's brilliant. Thank you.
No problem.
Okay. So what we'll probably do after today, Sarah and I will get together and arrange some provisional dates for shortlisting and for interviews, just so that we can, at the point of application, when you do apply, you know when those will be. But we will let you know in due course because the dates have only come out this week. So that's the very final dates. So a little bit about the Nursing Associate programme and what it looks like. So as you know, it's an apprenticeship programme. It combines both academic and work-based learning. So you'll be learning theory with your distance learning and with the modules that you're doing, but you'll also be learning within practice and supported to learn in practice to develop those proficiencies, standards of proficiencies that we discussed earlier for the Nursing Associate registration. So it's based on what would be called a level 5 foundation degree, and this is completed over 2 years. However, with the Open University, how we say the levels are is that we call it level 1, 2 and 3. You'll be working on parts 1 and parts 2, or level 1 and level 2. Rather than the traditional universities of level 5 foundation degree. So students have a primary placement or a core base. So this is where you usually work, and you'll be supported to learn within that environment too. So this is called the primary placement. And you can see that as your primary placement or your core base has been one long extended placement over the duration of the programme, which is 2 years. And the very bare minimum of external placements which need to be achieved or had within the programme is 2 external placements. However, it's usually more than that. There is a number of hours which need to be completed within an external setting, and I'll cover that in a moment. But there has to be a minimum of 2 external placements outside of the primary placement. So these placements, these can be in block practice, so going for a couple of weeks at a time. They could be a couple of days per week over a few weeks, or they can be what we call sort of a hub and spoke approach. But whatever we class as a placement, it's anything that's 5 days or more classes as an external placement. So external placements used to have a minimum of 2 of these, anything over 5 days or more. So there's some core content of the Nursing Associate Programme. So it focuses a lot on holistic and person-centred care. And this is because as we said before, it's about all fields of practice and having insight into all fields of practice, and also having a sort of experience and insight into care of people across the lifespan. It also involves sort of being accountable, a professional, sort of promoting health and ill health, providing and monitoring care, person-centred approaches as well, and communication. So some of the core aspects of care are included in the Nursing Associate Programme too. And also looking at research, development and innovation too. So just an overview of the programme here, of what it looks like. So as we said, there's the entry criteria there, and the programme is split over 2 years. So we have what we call stage 1 of the programme and stage 2 of the programme. And within each stage of the programme, students study what we call a theory module and a practice module. So within here, we can see the stage 1. The 2 modules which I've studied are called K102 and K104. Excuse me. And K104 is a practice module where students are supported in practice to achieve their proficiencies and also achieve the certain number of protected learning time and hours within practice. K102 is a theory module, so this is theory only, so studying some of the key principles and the key theories behind care. K104, even though it is a practice module, there is some theory involved in that, and there is also some assignments and work that needs to be completed as part of that. But K102 focuses solely on the theory side of the programme. So on successful completion of stage 1, students then move into stage 2, where again there is 2 60-credit modules studied alongside each other. K2 through 4 is a theory module which is specific for nursing associate students, and K211, which again is the practice module. Now, usually there would be, apart from an apprenticeship, there is an endpoint assessment. However, this has now been integrated within the programme. So that is part of the modules, the 4 modules which is completed, that is incorporated now within those modules. So 2 modules per year and 4 modules in total. I'm sorry if you can hear my dogs barking in the background. I think there's someone outside. There is a certain number of hours which need to be completed. So there's hours which need to be achieved, or theory hours, or theory requirements, and there's also supervised practice which needs to be achieved. Now, the theory hours, there needs to be 230 hours of protected learning time in theory, and 460 hours in applying theory to practice. Now, within the modules that you will do, so the modules K102 and K104, there's lots of activities within those modules which count towards this theory time. So this 690 hours that is required. So by completing those activities, by default, you will be achieving the necessary theory requirements for the programme. As part of the apprenticeship programme, students are required to have what we call off-the-job learning. So this is 20% of contracted hours. So the minimum hours that any applicants need to be doing is 30 hours per week. And that is so that the apprenticeship requirements can be achieved. So anybody working 30 hours a week or more can apply for the programme. And so it needs to be 20% of contracted hours, or a minimum of 460 hours, whichever is more, across the whole programme. So this is time which students need to be given as off-the-job learning in order to work on their theory within their module materials. So usually this works out to about 7.5 hours per week on a full-time contract, which students need to be given as part of the apprenticeship programme to study the theory side of the programme and be put in the studying the module activities. Any questions about that at all? So tutorials within the modules are mandatory. So as we said, this is all done by distance learning, and I'll cover that in a moment. However, there will be tutorials which are sort of spaced out throughout the modules and with the student's personal tutor, and these are mandatory. So even though we do say it would be beneficial for the students to have their off-the-job learning time when they have their tutorials, there are some ways around this, so it can be flexible. There also needs to be some supervised time in practice. So for the nursing associate programme, the minimum number of hours is 1,150 hours supervised practice over the 2 years. However, because of the practice modules that the students do also aligned with the nursing programme, each practice module needs to achieve 770 hours in practice. So that is the module requirement. However, for nursing associates, the NMC requirement is 1,150 hours over the 2 years. And I'll show you how that is broken down. So students need to have a minimum of 460 hours in external placements across the whole programme. So as we said, an external placement is counted as 5 days or more. So any place or any placement that a student goes to, which is more than 5 days, is counted as an external placement, and 460 hours within external placements needs to be achieved across the 2 years. Ideally, this would be split equally of having 230 per year. However, it's not always achievable. So it might be that only 200 hours can be achieved in stage 1. So that means that 260 needs to be achieved in stage 2. But the overall requirement is for the whole of the programme is 460 hours. So this is where students are needing to be released from their current roles, and they will be in an external placement where they will be supernumerary within that placement. And as we said, usually the placements can, I think, sort of the model that we work to, I think it was Sarah's still here, is usually about 2 or 3 week placement at a time, across at a few placements across the programme. Is that right, Sarah?
Yes, it is. However, if students are wanting to go to Kettering General Hospital, then it will be the full time for between 3 and 6 weeks in duration. So that will be sort of 4 days a week for that duration. They only offer block placements. So everyone else, we can work 1 or 2 days with over a period of time, but Kettering General do insist on block placements. The reason for this, and I suppose it's a good opportunity now to just stop and have a think about to talk about placements in general, is so just to give people some perspective, especially managers, because this is where generally we kind of come unstuck with these programs, is that over across the county there's a excess demand for nurse training places, whether that be registered nurses or whether that be nursing associate placements. So for example, this year there are 92 students that haven't got a placement with University of Northampton and are unable to actually achieve their practice hours before they register. So they're actually having to delay their registration because of the placement issues, because they've not been able to get placements in their practice hours in. So in order to mitigate this from the nurse associates and especially primary care, is that we've had an arrangement with the acute trusts that we work with, so Northampton General, the primary care, the NHFT and Kettering General, that we provide reciprocal placements. So for example, when your students are out on your external placements, then you will be expected to host one of their students from one of their hospitals or NHFT in their place for those days. So it has to be a reciprocal arrangement, or else we're not going to achieve practice hours. There just aren't the placements available for this to not happen. So if anybody's got any questions or wants some further information about this, I'm thinking particularly the managers that are on the call here, then please do, I can arrange to speak to you outside of this meeting, or I can, if you want to contact me directly, I can send you the information. Is that okay? Sorry, Leanne, over to you.
No, that's fine. No, I think it's also really important to point out that anything that sort of the required apprenticeship standards are that any external placement, protected learning time and off-the-job learning needs to be done within the students' contracted hours. They can't be doing anything within their own time. However, there isn't a requirement, because as you can see, there's not enough sort of theory to the actual amount of theory that needs to be covered won't be achievable within just the 7.5 hours per week. So there is an expectation that students will need to do some theory work within their own time. However, all the protected learning time, external placements and the off-the-job time needs to come from within their contracted hours. So across each year, the students need to have a minimum of 575 hours in supervised practice. Now, this encompasses protected learning time within the primary placement, so the usual place of work, or external placements. So ideally, we would have 230 hours of external placements within a year, and then 345 hours of protected learning time within the primary placement. So this is not supernumerary. This is really important, where students are supported to learn within their current place of work. So they're an apprentice learning to work. However, this is not supernumerary, but there has to be an element of protected learning time where students are supported to learn and need to have 345 hours a year within the primary placement in order to achieve that. So it's really important you think about students in their current role and what they're working in, and how that protected time in order to learn and develop can be incorporated into their working role. So students must evidence experience in all fields of practice and across the lifespan. Now, this doesn't have to be extensive experience, and it can be insights, but there needs to be some experience in all fields and across the lifespan. All students must have a practice assessor as well, who is a registered nurse or nursing associate, and also a practice supervisor who can be any registered healthcare professional. So it's making sure you've got enough people who are able to be practice assessors within the practice in order to support the student. So a little bit about the modules. So just to give an overview of what they look like, as we said, it is distance learning, and so students are given a calendar online and activities to work through. So it's broken down week by week, and it all leads up to when the assignments are due. So this is the same for K102 and K104. So both the practice and the theory modules. So students would work through the learning guides and work through the module materials week by week at their pace. In order to then work towards the assignments, and there's set deadlines for those. As we said, there is tutorials, and these are dependent on what the tutor can do. So the dates of the tutorials are released at the start of each module. So within each module, there's lots of different activities and lots of different learning. So there's discussion forums, there's online module materials, there's podcasts, there's a lot of different learning support and a lot of emphasis on reflection too. So there's a lot of activities which count towards the proficiencies in practice by reflecting on episodes of care. So a brief overview of just the first two modules. So K102 is a module which lots of students who are on health and social care pathways take part in. So this module is not just for nursing or nursing associate students. There's lots of other students who take this module, and so it can be quite an interesting discussion about different perspectives and introducing health and social care. So it's an introductory module, a level 1 module, and starting to get to grips with some of the key basics of health and social care. So there are nursing specific activities at the end of each block, and those are the activities which would count towards the required theory time. You can see that what we call TMAs, so tutor marked assignments, and also EMAs, which are end of module assignments, they have different weightings. So within K102, there are 5 tutor marked assignments of varying lengths and different approaches based on what has been learnt within the previous weeks. So students need to get an overall score of 40 or more on the TMAs, or an average score, and also get 40 or more on the end of module assessment in order to pass the module. If a student does not get 40 or more in the end of module assessment, then there can be an opportunity to resit. So K104, which is the practice module, starts to link theory with practice a lot more here. So you're starting to learn some of the key principles and some of the key theory behind what you are doing in practice, and linking it to the standards of proficiency for nursing associates. So things like nutrition and hydration, infection prevention and control, and assessment skills and care planning. So developing those practice related skills. As we said, even though it is a practice module, K104 does have some theory to achieve, and also some assignments to complete, but not as many as K102. So we can see that the first two are looking at professional development plans. There's also within this module what we call an ICMA, which is an interactive computer marked assessment, and this is based on numeracy and drug calculations and pharmacology, so medicines management there. So that is a quiz, an online quiz. There is also within this module what we call a practice assessment interview. Now this is where students have a 20-minute professional discussion with their practice tutor about, within this level 1, it is about person-centred care. There is also an end of module assessment, and within practice, students have to complete a portfolio, or what we now call a practice assessment document, which has various assessments within practice which need to be completed and assessed. So going back a bit to those hours and how it is broken down. So as we said, a total of 770 hours is required for the module. However, out of that, 575 are required for the NMC standard. So we can 195 hours is taken in any capacity. So we take any work completed as a HCA in the usual workplace setting. Then the rest of those are broken down into ideally 230 hours in an external placement. This needs to be in a contrasting setting. And this is where students are supernumerary within external placements. The 345 hours are within the primary placement or usual place of work. And this can be in spoke placements as well. So if there is a chance within the primary placement that students to spend time with other professionals or other I suppose services which are related to the primary placement, they can be counted as primary placement, protected learning. However, it's only anything more than 5 days or more which can be counted as external placement. So this protected learning time needs to be time, it's supervised as a student, but it's not supernumerary. So this is really important to realise that even though the student will be in their usual role within the practice, they need to have this protected learning time supervised and supported to learn within their usual place of work. So just an overview of what the learning looks like, or the learning journey within external placements. So these are placements outside the primary base. So it's going to be quite diverse. So there'll be a range of settings, a range of placements. And as we said, there needs to be, there is more demand for placement, there is actual placement. So it can often mean that students are required to go on placements at various times throughout the year. External placements are supernumerary, and placements are defined as 5 days or more, but students can have insight days into other areas when in any placement.
Leanne, can I just interject?
Mm-hmm.
So students must be able to get to placements that are offered.
Yes.
Whilst we try really hard to place you within your locality, that isn't always the case, and it's not always in our gift. So I just want to make you aware that if you're offered placements and you decline those placements because you can't get there, then obviously we would have to look at what are the ways we could mitigate that. But ideally, we would like you to be able to travel independently to placements where possible, because otherwise it will make your life particularly difficult, especially in achieving the minimum hours that you need to achieve. So I just kind of have to put that out there, because we've had lots of issues with that in the past, For example, there's a young lady that works at Kettering who wouldn't travel to the Woodlands Hospital in Kettering because it would mean that she wasn't on a bus route and that she would have to walk down the A14. So, you know, there's always been issues with travel and placement. So I just need to make that really clear that, you know, the expectation is that if you're offered a placement, then you are expected to be able to get yourself there and back. Sorry.
No, that's fine. No, I think it's also important to say, Sarah, about, you know, students being able to be released from their usual roles in order to attend those placements as well.
Absolutely. We try really hard to plan them in advance. Sometimes that's not always possible, but on the whole, the majority of the times it is. So, for example, the students that are currently that started in October of last year have just out on their first placements now, and we've also planned for their placements in July. So there's plenty of time.
Yeah. Okay, so this protected learning time in practice. So this can cause a lot of confusion because students who need to have protected learning time within their usual place of work or their primary placement. However, this is not supernumerary, and so this can often cause a little bit of confusion about how it is achieved. But it is something which needs to be thought out or thought about at the outset in order to achieve this. So what the NMC designates this as is designated time in which students are supported to learn, and all students are appropriately supervised until they have demonstrated proficiency in all aspects of care. So supernumerary status is one of the approaches to protected learning time. So within external placements, this is part of protected learning time. However, within the primary placement, this is not supernumerary. So with the OU programme, this was where we sort of define protected learning time as any shifts or times where a student is supervised, and this can be up to 10 days per year in spoke or insights visits to gain exposure into other fields of practice or other professionals. So this could be one shift minimum to be used as evidence. So there's ways that we can do it. Ideally, students would be supported throughout their working week in order to identify learning opportunities and develop their protected learning time throughout the working week. However, it can sometimes be easier to try and have some dedicated time per either a shift a week, something like that, but also considering the rest of the working week also. So it's not limiting learning to just a designated shift. But that is one way in which it can be done. And it depends on what works best for you and your practice. Students need to complete activity logs to show how they are demonstrating the proficiencies in practice. So supervised practice as a trainee means that they're allocated either explicit dates or times when they're working under the supervision. So this doesn't have to be direct supervision all the time, but there needs to be somebody who is there which can offer supervision. And we must report to them at the beginning and at the end of each shift if it's done in that way. So students can be encouraged to set learning objectives for this day, reflect on them at the end of the day, and also complete the timesheet. But a lot of things can be counted as protected learning time, and it's capturing all of those sort of pockets of protected learning time throughout the working week. So some examples of protecting learning time here. So we've got about reflective discussions, observing other professionals, being supported to develop, so whether it be about sort of developing knowledge of a particular drug, for example, attending meetings and ward rounds, professional discussions, and those kind of extended sort of activities which students can do within practice in order to learn and develop their skills from a healthcare support worker to a nursing associate. So I said about off-the-job learning, so a minimum of 20% of contracted hours. This can also be, this is usually taken as 1 day a week. However, for those who may work sort of longer days, you know, it can be averaged out over a month. So it is flexible, but it needs to make sure that it does equate to 20% of contracted hours. And this is where time is used to study module materials and complete assignments. And this doesn't have to be located within the practice environment. So just an idea about this. This is based on an inpatient setting. However, it gives you an idea about how protected learning time can be achieved within a primary placement. So we can see with this example, this particular student has their off-the-job training on the Monday with 7.5. On a Tuesday, they've spent the morning in their usual role, but in the afternoon, they've had some protected learning time. Sort of doing observations, attending a ward round. And you can see sort of these sort of supervised practice throughout the week, which leads to a total of 12 hours in that particular week of the protected learning time. This is within their usual place of work. So as we said, nursing associates are trained to work with people of all ages and across a range of settings, and need to be able to access placements in order to achieve that. Care must be evidence-based, best practice, and these experiences and learning are captured in what we call a practice assessment document and an ongoing achievement record. So there's just some examples of different external placements there. So as I said, we link in with the other services to provide these. So within practice, students are allocated a practice tutor or an academic assessor. It's the same person who is an employee of the Open University who supports the student and the practice assessor within the practice environment in order to achieve the skills and competencies required and the proficiencies required within practice. And a part of this, the practice tutor and the student and the practice assessor have 3 meetings throughout the module. So an initial, a mid and a final review meeting. So they support at a distance. However, they accept their sort of support and encourage and have contact with the student and the practice assessor outside of these meetings. There's lots of different support from various perspectives of students. So from an Open University perspective, there is a practice tutor or the academic assessor who supports students in practice. There's the module tutor. So this will be the person who delivers the theory side of the module and will support the student in developing their academic skills and completing their assignments. The staff tutor, so that is me, who at the moment who covers all the students doing the nursing associate program. So I'm the link between the employer and the student as well in supporting students on the program. And there's also student support teams as well. So if anybody has any kind of disability or needs additional needs with their learning, this can be accessed to. Students are also encouraged to develop peer-to-peer support and be a community of learners, either through their own sort of communications or, as we said, we have module forums where students are encouraged to reflect and share their experiences with others. Also within the practice area, there is the employer link, the practice assessor and practice supervisor. So lots of support there, and also a lot of support from different teams within the Open University. Now we're aware of the time, so I'm just going to end there. I just realised there's a whistle-stop tour of the programme, but it's really any questions about that? Any questions at all about the programme? I tell you what, is it Nadine? Have you got a question?
Sorry, I was just wondering, would it matter if my primary work is in the community?
No, not at all. No, it shouldn't make any difference whatsoever.
Okay, all right, thank you.
However, do you need to...
Nadine, oh, sorry. Nadine, can I just ask you where you work currently?
I work for General Practice Alliance. I'm in a collaborative care team.
Ah, brilliant. Okay, no, that's fine.
Okay, thank you.
I think the only thing with being part of the community team is thinking about, and definitely from your employer perspective, is you do need to have that, particularly when you work as autonomously in the community already, is making sure that you do have that supervised or protected learning time, working with other professionals within your usual role. So it's thinking about how that is going to be achieved and managed.
Okay then, thank you.
Okay. Any other questions? Is that Anna?
Yeah, hi, it's actually Nikki. I'm sitting with Anna. We work for the GP practice, and we've actually got two HCAs on the call today from two different practices under one big partnership. One of them would potentially be supervised by a paramedic. Would he need to register to get Pebble Pad or anything like that, or how would he be able to supervise? Because obviously he's HCPC.
The student can be supervised by any registered professional, but the practice assessor needs to be a registered nurse or a registered nursing associate. But there is who do you link in with, Sarah, to do the assessor training and the supervisor training? Do you offer it yourselves, or do you link in with the University of Northampton?
So we offer both.
Yeah.
So the University of Northampton is an hour and a half face-to-face on Teams once a month, and that will give you your Pebble Pad access. However, for the Open University course, they don't have Pebble Pad. They have My Pad, which is slightly different, so you wouldn't need the access codes for Pebble Pad. However, on the Training Hub website, so if you go to the Training Hub main website, if you go to resources, you'll see that there's SSSA training, so the standards for supervision and assessment training there in e-learning modules that you can complete in your own time, and it gives you a short survey monkey Q&A at the end that will generate your certificate of competence. So it can be done either way, and any professionals can undertake that training if they feel that would help them within that role. So it's not specifically for nurses, but it was written for nurses, if you see my point.
Yeah, that's fantastic. Thank you very much to both.
No problem.
Also, is with the meetings that the students have with their supervisor and the practice tutor, we also give an induction to the practice assessor and the practice supervisor about what they need to be doing within the practice assessment document. So we give an overview. So it is paper at the moment rather than Pebble Pad. I think somebody had wrote something in the comments in the chat box about 30 hours. Do you need to work? Yes, it is a minimum of 30 hours a week. Yes, because that's in order to be able to fit in and get all the protected learning time that's required, and also the off the job time. It needs to be a minimum of 30 hours a week. That's an apprenticeship requirement.
Has anybody got any other questions for Leanne or myself?
I'm going to come out and stop presenting. So what I can do is, if I send this presentation to Sarah, and then if you want to send it out to everybody, Sarah, is that okay?
Yeah, as long as everybody's registered
Yep.
as a contact, we've got your email details at the training hub, then of course we'll send it out to you. It's not a problem.
Okay, so I will meet with Sarah and we will have a chat about our deadlines. So for the applicant detail form and the shortlisting and the interview dates, we'll get those sorted out. So then once we have those, what will be your process, Sarah, for the students or any potential applicants for letting you know who want to be included on the applicant detail form?
I think probably what I'll do is I'll talk to Craig, who is our admin and manager, and I'll probably set up another Teams meeting, just a Q&A for anybody that's got any outstanding questions, and for also just to kind of let us know what their intentions are, and if there's anything that they can think of outside of this meeting that they would like us to chat through, that's absolutely fine as well. Is that okay with everybody? It might just be a lunchtime thing, sort of from 12 till 1 one day, and we'll be able to let you'll be able to access it, and we can take all the details and what have you.
Yeah. I suppose
Craig will also send out an expressions of interest form that people would just need to complete, and we'll do those both together.
Yep. So we'll get a date together for when we want those in by.
Yeah, no problem.
Okay, great. Well, there's no further questions. It's been good to see so many people here. Obviously, if you do have any further questions, do get in touch, or you need any more information, just let us know. But hopefully be seeing some of you applying for the programme. I look forward to supporting you on the programme.
Thanks ever so much, Leanne.